The information sent to you by the college will tell you when and where to attend your PACES examination. Allow enough time to arrive by the time stated on the letter. If you require any special arrangements to enable you to take PACES, please ensure that you inform the college of this before your examination day. By doing this, the centre will be prepared to accommodate your needs in whatever way necessary. When you arrive, please be prepared to follow any local infection control guidelines that are in place at the host centre. In many places, this now means having ties tucked in, sleeves rolled up to the elbow, and a minimum of hand or wrist jewellery. If this might be difficult for you for any reason, please inform the college in advance of your arrival. Your personal identification and admission documents will be checked, and you may be asked to fill in your name and examination and centre numbers on your mark sheets in the company of the 4 other candidates sitting the examination with you. You're asked to carry your mark sheets with you around the 5 stations and should be given a clipboard to make this easy. An administrator at the centre or the host examiner themselves will ask you to turn off your mobile phone and will explain the procedure and timings for the cycle. You will be told the station that you will start at. Use this time as an opportunity to ask any questions about the conduct of the examination or arrangements for your cycle. Remember that you may be asked to wait in the centre for a period following the completion of your own cycle to ensure that the security of the examination is not compromised. Whilst you are waiting to start, the examiners will be calibrating, seeing the patients themselves and agreeing what candidates must do to attain a satisfactory mark for the various skills assessed. The PACES carousel is comprised of 5 stations, each of 20 minutes, with an additional 5-minute period before the start of each station. Each cycle of 5 candidates therefore takes 125 minutes to complete. Candidates waiting to enter stations 2, 4 and 5 use the time to read the scenarios for those encounters. Stations 1, 3 and 5 are comprised of 2 10-minute encounters and stations 2 and 4 of 1 20-minute encounter. A total of 8 encounters therefore occur. You could be asked to start at any of the 5 stations and will then rotate clockwise through the numbered stations. 5 minutes before the start of the first station, you will be shown where to sit. Remember that you carry your mark sheets with you throughout the cycle. Bring your own stethoscope with you, but please notify the college in advance and the centre on the day if you will be using an electronic stethoscope. Any other equipment you might need will be available, but feel free to bring your own ophthalmoscope and other equipment if you prefer. If you start at station 2, 4 or 5, you will be given a scenario or scenarios to read. Remember that each encounter represents a task. Read the scenarios carefully and note what you have been asked to do. Scrap paper will be available to make notes before and during the encounter. Feel free to use it. The examiners or an administrator will usually take the mark sheets for each station before you start. If they don't, you will be asked for them when you enter the station. Each 20-minute station of the examination is started with a bell or buzzer. When the bell goes and the station starts, you will be introduced to the examiners. Before you start the encounters at stations 1 and 3, the examiners will show you a patient introductor, a brief statement that explains what you have to do and what the patient has complained of. If uncertain about what you are being asked to do, please ask. At the other stations, 2, 4 and 5, you will have had the chance to read the scenario outside and are allowed to bring it into the room with you. Remember that the examiners are there to help you show what you know and what you can do. If you don't understand a task or question, please ask for clarification. Before you start, the examiners will remind you of the timings for the encounter. This slide shows these timings. You have 6 minutes to examine the patient at respiratory, abdomen, cardiovascular and neurology, followed by 4 minutes discussion. The examiners will tell you after 5 minutes that you have 1 minute of the 6 left. At stations 2 and 4, you have 14 minutes with the patient, and the examiners will remind you when there are 2 minutes left. At station 5, you have 8 minutes with each patient and 2 with the examiners, and a warning is given in each case when there are 2 minutes left. Manage the time available, and remember that at stations 2, 4 and 5, you should summarise to the patient what your management plan is and try and finish the consultation in the same way as you would a real consultation. After being introduced to the examiners and your patient, make a start. When the time is up, one examiner will ask you questions. Occasionally, the other will also do so. At stations 1 and 3 and 5, the examiners will take it in turns to take the lead between the two encounters, with one taking the lead for the first case and the other the lead for the second. At stations 2 and 4, one examiner will take the lead for your discussion of the single encounter. Examiners will be trying to let you demonstrate what you can do and asking questions to allow you to show what you know, not to trip you up or trick you. If you don't know the answer to a question, say so, and the examiner will move to another area of questioning. Examiners understand that you may be nervous and will take that into account in their assessment. In the next section, we will explain the 7 clinical skills that you are being assessed on. Marks in the examination come from your performance in these skills alone. The onus is on the candidate to demonstrate these skills during the encounters. In stations 2, 4 and 5, make sure in particular that you explain your plan to the patient and respond clearly to any questions the patient asks. Manage your time carefully and try and manage the encounter in the manner that you would in real life. Remember to wash your hands before and after every encounter. Each station will end with a bell or buzzer, and you will be shown where to go for the next station. If you have started at station 2, you will move on to station 3, and so on. You have 5 minutes between each station to rest or to read the scenarios provided for the next station. After you have been through all the stations, your assessment will be over. Remember, no one at the centre is permitted to give any feedback regarding your performance on the day. Remember also that the test should be fair for all. Do not discuss the cases you saw or scenarios you encountered with others about to be assessed. Try and put the examination out of your mind for a while. You have done all you can to get through.